All right, welcome back, everyone. So now we're going to talk about one more issue, or two more issues, I apologize, associated with the liver. The first one is non-alcoholic fatty liver disease, which sometimes people just abbreviate as fatty liver. What happens when an individual has fatty liver disease is they have the infiltration of fat. Typically it's triglycerides. And what happens is the hepatocytes then are infiltrated with this fatty substance that prevent them from doing their appropriate liver function. So this is not connected to alcohol. This is connected to things like obesity, dietary, so an increase in cholesterol and triglycerides. They sometimes link to type 2 diabetes. This is a fairly common problem in the United States. So, in fact, it's the most common liver disease in the United States, and really it's linked a lot to things like this and poor diet. Okay, how do we treat it? You treat it with diet and exercise. So you want to lower your fat intake, lower your cholesterol intake, triglyceride intake, lower your alcohol or cut out alcohol altogether. We don't want to exacerbate the condition, and take on an exercise regime. Okay. Last issue associated with the liver is hepatitis. All right. Hepatitis is a viral infection of the liver. So there are different strains of hepatitis, so it's A through E. There are 5 types total. So hepatitis A and E are acute. That's an acute infection. B, C, and D are chronic and could eventually lead to liver failure if left completely untreated. Now, there is a vaccine for A and B. There is none for C. B and D, usually when someone has B, very often they develop hepatitis D as well. A and E tend to come from contaminated food and water sources. And for the most part, if you're infected with hepatitis A or hepatitis E, your immune system is able to combat the infection pretty readily, so you're sick for a few weeks and then feeling better, which is why it's an acute condition. All right, so how do we get hepatitis and how do we treat it? Okay. So oftentimes, hepatitis B and C can come from contaminated blood and body fluid. So a lot of people, well, not a lot, but people of a certain age that perhaps maybe had gotten tainted blood or had, in the case of hepatitis C and B, I should mention, can also come through sexual contact that perhaps they were infected with something like hepatitis C maybe many years ago. It lied dormant in their body for quite a while, and now as they're getting older, they're seeing the manifestations of hepatitis C. So it can be sexually transmitted through blood and also through body fluid. Hepatitis B, we saw a lot of infections of Hep B with intravenous drug use as well. Okay, so how do we know we have it? So there are certain blood tests that can be used to assess the presence of hepatitis B. They look for antibodies associated with hepatitis B and C. Also fatigue and jaundice. Okay, so the treatment for now hepatitis B, again, most people are vaccinated against hepatitis B, especially under a certain age. But for hepatitis C, they have treatments that are immunoglobulin-based treatments. So they give antibodies to people who have Hep B from somebody who's had it produce antibodies and kind of come out on the other side. Or they can do an interferon-based treatment. And again, interferon, there's a class of interferons that will interfere with viral replication, and so by doing that you're trying to control the viral load of Hep B so that the patient is not symptomatic. There are also other antiviral treatments that are given. to patients with hepatitis B. Ribavirin is one. That's an antiviral preparation that's used to treat hepatitis B. For some patients, they have success with this, and some with immunoglobulin therapy. Okay. All right, so let's talk about your liver's next door neighbor, which is your gallbladder. So let's talk about gallstones. Okay, so first off, why is your gallbladder important? Your gallbladder is important because it stores bile, and bile is critical for the digestion of fat. So if someone either has a blockage of the common bile duct, that bile is produced but can't quite get into the duodenum of the small intestine, when they eat a fatty meal, they would be symptomatic and have pain associated with that. Okay, so most gallstones are calcium carbonate. And what happens is you get, these are generally formed from the impaired metabolism of things like cholesterol or from bilirubin or bile acids. And what can happen is the stones can become lodged in the duct system that connects the gallbladder right to the duodenum. So it would impact the common bile duct. So that would trigger pain, especially when you're eating a fatty meal, because you're not breaking down the fat, and now it's becoming somewhat of an irritant to your digestive system, right? So if you block the duct, you can have bile in the gallbladder, but it can't quite get down to its final resting place in the duodenum. It can also cause flatulence, pain, diarrhea, cramping associated, especially again when someone is eating a fatty meal. Probably about a half an hour after they've eaten that fatty meal, they would become symptomatic. Okay, so the treatment for this is to remove the gallbladder sometimes, or to remove the stones, or they can do a procedure to break up the stones so that they don't obstruct the duct, or do a balloon dilation of the duct so that you can kind of push whatever, if they're smaller pieces, kind of out of the way, and that's going to allow for the common bile duct to be open so that bile can get where it needs to be. All right. So the last thing we want to talk about is I'm going to talk about pancreatitis. Just very generally. And you have, much like gastritis, you have both acute and chronic pancreatitis. So here's the issue with the pancreas. We want to think about what it does, right? So your pancreas produces lots of enzymes, and those enzymes help to break down sugar and fat and protein, right? So when someone has pancreatitis, whether acute or chronic, it means they have inflammation of the pancreas. Now, acute pancreatitis is usually due to some sort of obstruction that prevents pancreatic juice from leaving the pancreas via the pancreatic duct. It can be linked to things like alcohol, infection, drug use. Okay, so if the pancreatic juice contains lots of enzymes for breaking down, you're trying to break down those biomolecules. Well, your cells are made of biomolecules. So if pancreatic juice can't get out of the pancreas and is kind of stuck there, what will happen, is you will start to auto-digest. The pancreas will start digesting itself. Okay, so it's going to trigger inflammation, then potentially autodigestion. Obviously, this would cause a lot of pain, nausea, vomiting. As a marker, we would see an increase with pancreatitis in serum lipase, which is an enzyme that's going to break down fat that will rise because we're not breaking down any fat. Acute pancreatitis, if it's not treated, is fatal. Okay, how do we treat it? They treat by the treatment's really aimed at stopping the autodigestion and kind of resting the pancreas and trying to prevent any further complications. And in the meantime, have to discern what the root cause of it. For example, is it something infectious? Is it alcohol abuse? Okay, we have to tease that out as well. Okay, chronic pancreatitis is almost always linked. Okay, chronic pancreatitis means you have progressive destruction of the pancreas. It's kind of like cirrhosis in that you're getting this fibrotic tissue put in place where the acinar cells of the pancreas should be. Okay, remember, your pancreas has both endocrine and exocrine function, right? The exocrine function is the digestive piece, but you also have an endocrine function which is involved in the control of blood sugar. If we are destroying the cells of the pancreas, now we're going to have kind of two sets of outcomes, the digestive problems and then the problems associated with your patient no longer being able to control their own blood sugar. This chronic pancreatitis is very often associated with alcohol abuse. So again, I had said when we started kind of talking about all the digestive things, your stomach, liver, and pancreas take a hit if you abuse alcohol, okay? The signs and symptoms, obviously you would have severe abdominal pain, but you would have weight loss because you're not absorbing any of the nutrients, you're not completing that digestive process, and poor nutrient absorption. So the bottom line is someone is not going to be getting any of the nutrients that they should be because they simply can't break them down to absorb them, okay? The outcomes of chronic pancreatitis, you're going to have a decrease in the production and release of pancreatic enzymes, right? Because you're impacting those acinar cells, but the other outcome you would have is you would now have insulin dependency. Because if we're also impacting the pancreatic islets, then you can no longer produce insulin and glucagon and cannot properly control blood sugar. So we're going to wind up with diabetes. Okay, the treatment, if it's linked to alcohol abuse, your patient needs to stop drinking. We need that to stop immediately and rest the pancreas. And then one of the things that can be done in certain cases is you would also give medication to kind of aid in digestion and manage some of the diabetic symptoms. But also there are options now to transplant cells of the pancreas so that you might get recovery of some of that pancreatic function. Chronic pancreatitis is one of the risk factors for pancreatic cancer as well. Okay, that's going to do it for digestion, guys.